Hello everyone, this is David Nyako and I'm here to present to you some of the key elements of the healthcare system or healthcare policy in Ghana. So, birth of Ghana's healthcare or health insurance scheme. So, in the past, the system that was in place was called cash and carry. So, cash and carry. So, you pay cash and then services or your product or commodity was delivered to you. So even in emergency situations, people or citizens were still required to make some down payment before health services were rendered to them. All right, so government decided to move from that system somewhere around 2003 and introduce the National Health Insurance Policy to set up a pool or a fund and make some contribution to it so that government can support all citizens to receive affordable health care and move over from the cash and carry system. This was so also to provide healthcare to all citizens in the country. All right, so uh, they set up three different schemes: the National Health Insurance Scheme, the Private Mutual Health Insurance Scheme, and the Private Commercial Health Insurance Scheme. And the law made it compulsory for all Ghanaians to join at least one of the schemes. The popular one, the National Health Insurance Scheme. All right. So in terms of cost contributions, government set up a 2.5% health insurance levy on selected goods and services. That's how they got funds to support it. And citizens um, were also allowed to make contributions towards the scheme in accordance to the levels of their income. So according to the levels of income, different groups were made. So poor, middle income, very rich people, they all had different contributions. The poor, or very, very, very poor people, uh, had to contribute nothing to receive full benefit of the health insurance. And the very rich people had to contribute 480,000 Ghanaian cedis per year to receive full benefit under the scheme. All right. So coverage, there are 212 districts in Ghana, and the government supported all these 212 districts who had the option to include certain diseases that they wanted that were popular in their areas. So lawmakers also made it compulsory for Ghanaians to join one of these schemes. So everybody was covered under the new National Health Insurance Scheme. All right. So 95% of diseases in Ghana were fall among malaria, diarrhea, skin diseases, hypertension, asthma, upper respiratory diseases, and most Ghanaians that enrolled in the National Health Insurance Scheme were covered under these diseases. Okay, so the government also set another list, the exclusion list. So these beautification surgery, supply of age drugs, heart and brain surgery, dentures, orthopedic, aids, optical stuff, stuff like these, they were not, they did not contribute to 95% of the disease population. So government is decided to exclude them and they cost a lot um, for treatment. So government decided to exclude them so that the funds, the healthcare scheme could be saved. So they allowed the 212 districts to make their own option as to include these or not, with the National Health Insurance Scheme approval. So in terms of quality, better healthcare service for all, no quality was not compromised. But at the same time, low number of beds, lack of sufficient hospital facilities and medical equipment, which was still a problem in the past, was still a problem in the new system, even though it was very improved. Okay, so in summary, it covers all Ghanaians, the National Health Insurance Scheme. That covers 95% of the disease population. And in terms of cost, both government and the private citizens make contribution towards it. And the choice, people had a choice to choose um, to be under any of the health insurance scheme. Also, they had a choice to choose their to make a choice of doctor, physician, or facility. Thank you for being in my class.